To my video on the sheep heart and the dissection. My name is Sean Glass, and so we're going to be discussing the gross anatomy and internal anatomy of the sheep's heart. Let's get started. What you have on the outermost layer of tissue of the heart is the visceral pericardium. That's what you see right here. It's white and it is somewhat fatty. It becomes more fatty as people age. This fat definitely allows for good conduction of electricity, and so that's very important for the heart. We have the apex and the base of the heart. The apex of the heart is located right here. Apex is actually the point at the, you would think of at the bottom of the heart because it's the area that's furthermost towards your feet. And then you have the base of the heart, which is this area up here, and that's the area that's more cephalic. So the base and the apex, kind of like if it were a mountain, it's switched around. Let's talk about the right and left atria. So you have the on this side right here, you have the right atrium, and the right atrium is this area in here down to this valve, which is the atrioventricular valve, or well, for the right atrioventricular valve. And then on this side, if you can see it, there we go. We have the left atrium, and the left atrium is roughly the same size, a little bit bigger than the right atrium, and separated from its ventricle by the atrioventricular valve there. Okay, so on top of each of the atria, you have the auricles. So the auricles essentially are reservoirs for blood that send blood down to the ventricles on their respective sides. So you have the right auricle here that sends blood to the right ventricle down here, and that blood is going to be deoxygenated. And you have the left, see here, the left auricle that sends oxygenated blood down to the left ventricle. Now, while we're talking about ventricles, you have the right and left ventricle. The right ventricle is located right here, and it is the area that is here inferior to the valve that I've pointed out right there. If you were to look at it on the outside, it's comprised of mostly this area here. It has a relatively thin muscle, or it's called myocardium. If you look on the the left side of the heart, you have the left ventricle, which has a much thicker myocardium. See how much thicker that muscle is than muscle over on that side. And the left ventricle is separated by the AV valve here. What you have in the right atrium is you have I believe, I don't know that we touched on this, but in the right atrium you have deoxygenated blood versus the left atrium where you have oxygenated blood. Now, for the ventricles, you have an area known as the interventricular sulcus, and that's a collection of blood vessels which has major blood vessels that include the interventricular arteries, interior and posterior, the circumflex artery, the left and right coronary arteries, and the marginal artery. Let's move on to the pulmonary trunk. The pulmonary trunk is an area that connects from the right, essentially it connects from the right ventricle by way of and let me go ahead and get you to the right ventricle. So here you see the right ventricle. And what it does is the pulmonary trunk sends blood to the lungs in order so that blood can be oxygenated. And so at this point, the blood going through the pulmonary trunk is deoxygenated. It picks up the oxygen and then is returned back to the heart via the pulmonary veins. Now, for the aorta, where is the blood in the aorta, which I've pointed out for you? It's right here, this area right here. The aorta actually pumps blood throughout the rest of the body through its several branches. You have the aortic arch, which branches off into several arteries, and the aorta sends blood throughout the entirety of the body, and so it's a very important blood vessel. Now, the ascending aorta, as I said, now you might not be able to see it on here, but the ascending aorta actually is going to be this part, and it should branch off or actually have more of an arch to it, but it wasn't included in this heart that I have here. As far as that goes, the aortic arch typically has three major vessels. You have the brachiocephalic artery, which we are fortunate enough to have, and that's this artery right here. Let's give you a little bit better of a view. That artery right there. Okay. And then you also have the common carotid, the left common carotid, and the left subclavian arteries. Those aren't featured on here. Let's move on to superior and inferior vena cava. The superior and inferior vena cava are both venous structures that that actually carry blood into the heart. So you have the inferior vena cava, which is located here, and the superior vena cava, which is located in this area. I'm sorry, move my hand. Right there. See how I'm pointing into that opening there? And so the superior and inferior vena cava, in addition to the coronary sinus, which is this area that I'll point out right here. There we go. That is the coronary sinus down in there. These all carry blood into the right atrium. These vessels are all veins, and the blood that they carry is deoxygenated blood getting back into the heart, ready to be oxygenated. We're going to stop the video right here, and we'll record the rest.